We see as young as like 12 months sometimes, up until age 20 right here in Buffalo, but we also see some of our surrounding suburbs and also do a lot of virtual work too for some people that are further away. If you were to call and get services with us, we originally would set you up with a therapist, which that would entail kind of having an intake session where we kind of get background information on you, your family, your child, or your and information just to see what's been going on, what are the struggles you're having, and then from there you kind of get assigned to a treatment plan with some goals that you want to work on, different treatments that available options that we have, and then if needed to, we have psychiatry, so there's therapists, which are psychologists and social workers, and then we have psychiatrists who would prescribe medicine. If that's needed as well, we can make a referral to our psychiatrists, which are in-house here, which is very nice, and it's a collaborative approach. When we're thinking behavioral health, we kind of think of behavioral disorders and thinking about kind of like a lot of like outbursts, right? Behavioral stuff that is being attended to, and then mental health is kind of more of our like emotional disorders when we're thinking about like anxiety and depression. So I think the number one thing that I always like to tell parents is that children often don't express the emotions that they're feeling in a way that's easily recognizable. Even as simple as the language, if a child is struggling when they come into our office, when they're talking about, hey, my kid is, crying aloud or screaming, and really stick to what the behavior is, and rather than label it as like a tantrum, to actually say they're angry or they're frustrated and they're unable to express themselves after this happened. Because once we start using the labels like tantrum or, they're acting out, things like that, when we use that language, it actually can bring a lot of shame to your kid. And we want to be mindful that here that they are experiencing, especially again, if this is in response and they weren't experiencing these outbursts before, that then, we are able to kind of bring that supportive language so that it encourages them expressing themselves rather than having this response that's shameful.